Hi guys, so I wanted to jump on here and talk about what do you want to know about therapy. So I have had a few questions about this, so I thought that it would be helpful just to, hi guys, if you've got any questions that you want to know about therapy, then just drop them in the comments. I've had a few things that people have asked me about just the therapy process in general, so I thought it would be helpful to jump on and to do a video just explaining about the therapy process. So I said, if you've got any questions, I think there's a comment badge at the bottom. Oh, thank you, Christina, that's lovely. Thank you for buying the badge. So yeah, there's a comment box in there. So if you've got any questions about therapy, then just jump on. I think one of the things I always explain to people is the importance of picking the right therapist. There are quite a few of us about, and I think making time to talk to your therapist, ask for a brief consultation, and that will kind of help you to see if you can get on well with the person. Often when you're going into therapy, you're going to be talking about things that you don't tell anyone else, so it's really important that you've got a good rapport with someone and you feel that you can connect with them. So there was a question up here. I want to find out how CBT in Pennsylvania. I think that in terms of, I'm not sure with America, so I'm not really sure, but what I would suggest is if there's any sort of registers or anything like that in your local area, just to type in Google for CBT therapist. In the UK, we have things like Counselling Directory or Right Therapist, to maybe see if there's something similar that you can look into. Hopefully that helps. Sorry I couldn't be of more help. So initial appointment. Thanks, Ellie, that's a really good question. With the initial appointment, the first thing is, if you have a consultation, then that'll be something slightly different. That's normally that 15-minute that I was just talking about, like making sure that you can get on well with your therapist. But in terms of the initial appointment, you don't really have to worry about much about that. That's kind of the therapist's job, to ask you a lot of different questions to find out what's going on for you at the moment. So it will be a lot of questions and answering, and obviously some reflections of what's brought you to therapy, what do you want from this therapy, and hopefully by the end of the initial appointment is that you'll have a plan of the therapy. Within CBT, we would be able to say, okay, this is going to be what we're going to be focusing on, and this is how we're going to do it. So maybe even giving you a number of sessions, but that is obviously a tricky one to be able to say because everyone's different. But the initial appointment is just getting to know your therapist, getting to know the type of therapy that you're going to do, and just speaking a lot about what's brought you to therapy and also how you can get over it. In CBT, we will often set goals. So kind of, what are your goals? What do you want to get out of therapy? And then we'll align the therapy with that. Hopefully that was helpful, Ellie. What sorts of questions should we ask a therapist to see if we're a good fit? Again, I think that's really, really helpful. I think that just getting an understanding of how that therapist works, so kind of just seeing even their personality, it may be about their even the sense of humour, but just maybe ask them what their qualifications are, maybe ask them how long they've been practicing. You might want to know if that therapist have had experience of working with what you want help with, and being able to get an idea if they're the right person to help you through your difficulties. They would be kind of some really important questions, and asking if they've got any governing bodies. Again, in the UK, I've got 2 governing bodies that I'm registered with, so making sure that they are registered with the appropriate governing bodies for what you're looking into. And you can easily look that up wherever you are. Just look up kind of like CBT therapist governing body, which in the UK is the BABCP. So making sure that they're appropriately qualified for what you want. That's helpful. Christina, I think I'm not sure, maybe even if it's the medicine app, if that is an insurance company, I don't know whether if you used to go through them, if that would be helpful. What kinds of therapy can be offered after CBT? I've only been told about psychodynamic, but that people my age don't get it until they're older. Cameron, I'm not sure how old you are, but in terms of different types of therapy. So after CBT, it would really kind of depend on what your needs are, to be dependent on what type of therapy that there may be. You have EMDR, you have schema focused therapy, you have more of just talking therapy, and then you have counselling as well. So maybe thinking about, okay, you finished CBT, but what is it that you still need support with, and maybe look up the types of therapy that would be best for that difficulty. That might be the best way to kind of sort that out. Danielle, how would you advise to release trauma? I think with that when you are trying to get over trauma, I use trauma focused CBT, which is really helpful to be able to process the trauma and to be able to release it as well. And sometimes you can look into EMDR, which is also really helpful for trauma. Then you have brain spotting, which is also really helpful for trauma. And even the emotional freedom technique, so that's the tapping technique. If you have a look on my IGTV, I've got a video demonstrating how to go through the tapping process, which can help to release trauma. And again, with that, when you're looking at releasing trauma, it's just super important that you get the right therapist who's had experience of working with trauma and who have the right qualifications to be able to help you to release that trauma and work through that. Cameron saying you're 20, so I'm not sure. I don't do psychodynamic therapy, so I wouldn't know why they wouldn't offer it to you at that age. But definitely, for whatever you're going through, CBT is generally quite a helpful technique. Obviously, it doesn't work for everything, but have a look at thinking about what your needs are, and then look at kind of what could be offered after therapy. Okay, why do you think there is an adversity in America to CBT? Oh, I'm not sure. I didn't know that there was an adversity in America to CBT. That's really interesting. I don't know, because in the UK it's what we consider one of the gold standard of therapies. So that is really interesting that there is that adversity. I don't know, there used to be some really good websites where you could do some CBT work on yourself in terms of self-help books. There's a really good Australian website called CCI, and it has a lot of self-help books that use the CBT model. So if you're looking specifically for CBT, that may be really helpful for you, and you can actually work through it yourself. They do it for low self-esteem, generalized anxiety, low mood, body dysmorphia, lots of different things that might be helpful. Yeah, so maybe working through the workbooks might be quite helpful to really be able to kind of see how you can go through. The good CBT is private, and that's again the difficulties is so, like, in the UK we're very fortunate enough to have the NHS that you can get CBT within, but again, sometimes I know some people that I've worked with that the waiting times can be super long. But having those workbooks and being able to work through some of the things initially by yourself can be really helpful. And even using YouTube, I upload a lot of videos on there that kind of talk through the different techniques that you can try out yourself. As I mentioned with that tapping technique on my IGTV, you can follow that, and that it can be used to release trauma. It can be used to release self-limiting beliefs, to help you when you are stuck. So it's about being able to free yourself from overwhelming emotions that you find really difficult through tapping through the different meridian lines on your body. So that can be really, really good as well. Thank you. Does anyone else have any other questions? I'm talking about kind of what do you want to know about therapy, if there's any difficulties. So we've spoken about what you would expect in the initial assessment, and about really finding, as I said, that you find the right therapist for you. And as I said, I think that is one of the key things. And there are kind of so many different therapists and so many different backgrounds. So it's really kind of making sure that you find the right fit. Some of the other questions that I often get asked with CBT is kind of like, how quickly will it work? And again, that's a really, really difficult question to answer because it is different for everyone. But with CBT, the main thing is that putting in the work between the sessions. There was some research that said about 70% of change happens outside of the therapy room. If you think you may be going into therapy for only 1 hour a week or 1 hour every 2 weeks, practicing the skills that you learn so you can use them in real life is so important, and being able to reflect on the ones that don't work. And I think that's something that's really important, is that if the therapy isn't working and you're not feeling better, tell your therapist. It may be that they may not be looking at the right things, or if there are kind of certain things outside of the therapy session that you're not talking about that are impacting on your ability to engage well in the therapy, then again, that's something that you need to bring up and talk about with your therapist and be able to problem solve them. So being able to answer that, and we don't know everything, so if you think we've got something wrong, then tell us. So dynamic open mechanism my therapist has offered me is thought challenging. Should there be more just this? I have had 2 CBT treatments and been in therapy for well over a year now, but it hasn't worked and I'm worse than where I started. I'm really sorry to hear that. CBT is a lot more than thought challenging. Yes, with CBT you have the cognitive behavioural therapy. So with the thought challenging, that is handling some of the cognitive element, but there should be a lot more looking at the behavioural side of things. So say if you are thought challenging things that make you anxious, you can challenge the thoughts all day long, and that can be really effective, but you need to be able to put it into practice. So when we're looking at anxiety, we often look at placing ourselves in situations that make us anxious, not the situations that make us the most anxious, the situations that kind of make us the least anxious, and then you work up so you can try it, because anxiety only can stay in your body at a peak for about 20 minutes. So if you're able to kind of ride through that 20 minutes, it's definitely going to be something that you can see that you can last. Anxiety tricks you to think that you can't last in a session, but if you're able to sit there and almost like ride out the anxiety will drop. And the more that you do those situations, the lower. If you kind of imagine it kind of goes up and down the first time you try it, and then if you continue to do it, it will go less and less and less, because you're learning that you can manage that anxiety. It's your mind's kind of playing tricks on you. So yeah, I would really maybe speak to your therapist and say that, okay, the thought challenging is good, but it's not enough, and request for more. There are so many different things in the CBT toolbox that they can use that will be helpful for you. So that's really what I would say to do, and hopefully that's helpful. And I'm really sorry that you feel worse than when you started. That shouldn't be the case. So yeah, thinking about in terms of therapy, is there anything else that anyone else wants to know? Again, another question that I get often is what happens after therapy, and we kind of spoke a little bit about that. But when you finish with therapy, when the area that you've targeted, you should feel satisfied that you're going to be able to manage that difficulty moving on. And how I always explain it to my clients is that by you going through therapy, you are going to be able to be your own therapist at the end of that. And so you will have the skills at the end of therapy. And if you come to the end of therapy and there's still other things that you need to work on, I always recommend to my clients to go away for a couple of months, practice all the skills that we've done. And if you still feel that there is a need to work on different areas, then by all means we can do that. So that will be something that I would often say to people. And it may be that you need a different style of therapy. I know I'm talking a lot about CBT because that's what I'm qualified in, but it may be that you do need more of a psychodynamic therapy, or even looking at schema therapy, which I also do, and often I would do that first before the CBT. But if someone came for me, had been somewhere else for CBT, and then they want to start schema therapy, then yes, we could do that. There's another question. You are welcome, Cameron. Can you take a partner to a CBT session to give another perspective, or is it better to be alone? Ooh, Emma, that's a good question. It's really difficult. I've had people bring their partners. I've even had parents come along. It really depends on what. So you want to know if it would give them another perspective. I would say maybe you go to therapy first so you can kind of understand what you want out of the therapy. If you want the therapist to maybe know from your partner's perspective, you can always get them to write a letter, or if you feel comfortable to bring them along, then ask your therapist if that's okay. But obviously the therapy is there for you, but it can be helpful to bring another person along. But I would say first of all, go by yourself. Saying that sometimes the initial assessment can feel quite overwhelming, so you may choose to bring someone with you there, but have an agreement with them about how much you want them to talk, because you don't want to bring your partner into therapy and then they're over talking and you don't feel a space that you haven't been heard. So I would definitely kind of have those agreements with your partner beforehand. Hopefully that's answered that question. Hi Kelly, does being HSP contributes to CBT? Can you explain what HSP means? Sorry. Does being HSP contributes to CBT? Yeah, if you could let me know what that means and I can answer that question. What's the best therapy for emotional abuse? Oh, Emma, thank you. It's more a family member. I would still say kind of have a think about it, and if you think that it will be helpful for them to come along to the therapy, then kind of by all means bring them, but the therapy should mainly be for you first. A highly sensitive person, thanks. Contributes to CBT. I'm not really sure if are you saying that you're a highly sensitive person, or that kind of that some, I suppose, how does that contribute to CBT? I think that kind of that you could look at maybe like your emotions and how that kind of manifests within CBT, and if that's something that you want to work on. CBT can definitely be helpful for kind of emotional regulation, emotional management, and you also have kind of mindfulness-based techniques can be helpful for that, and also DBT, which is dialectical behavioural therapy, which can be really helpful kind of for managing the emotions, if that's kind of what I'm understanding that you mean. But it can be looked at within CBT in terms of being able to rationalise maybe some thoughts, and maybe help with kind of managing the emotions, if that's something that you would want to look at. There was another question. What's the best therapy for emotional abuse? I think there can be a range of different therapies. It really depends on what you want to get out of that. Whether it's being able to process the emotional abuse as a safe space to talk about it, and to be able to overcome maybe things that are holding you back. Hopefully that answered the question. But yeah, I think with emotional abuse, obviously it's a really tough area, and obviously extremely difficult to experience, but just mainly having a supportive someone there that can really work through that with you. And again, that kind of goes back to the idea of picking a therapist that you can really connect with, and that you feel supported by. So I would think about what is it that you want to get out of the therapy, and then being able to pick a therapy based around that. Okay. I've got a couple more minutes, guys. Is there any other questions anyone wanted to ask? Thank you for all your questions so far. Hopefully I've been able to answer them. Okay. Cool. Okay, well, thank you guys for joining me. I hope you found it useful. I will save this and upload this, and yeah, thank you, and I hope you have a good rest of your day.